Okay, welcome to our first in our series of Medicare changes for 2024. As most of you probably know, open enrollment started yesterday, October the 15th, and will continue on through December the 7th, and there's an error, should be through 2023 rather than 2024. So what we're going to cover this morning is a little bit on enrollment, premiums, deductibles, copays, and benefits. So last week, fortunately, the Social Security Administration announced the cost of living increase. For 2024, it will be 3.2%. So if you get $1,000 a month in Social Security, you'll be basically getting an increase of approximately $30. That should be enough money to be what we call hold you harmless, meaning that most people will, although there will be an increase in the Medicare Part B premium, the Part B premium increase will be less than the increase in what you receive in Social Security. The most important thing to know when you're looking at Medicare is parts versus plans. And I feel like I say this all the time, over and over and over, but it's really important that you understand the difference of all of those. Because Medicare has parts. The insurance companies that sell Medicare Advantage, prescription drugs, and Medicare supplements all have plans. So what we see at this point in time is that Medicare has parts A, B, C, and D, and then the plans, there's a plan for Part C, a plan for Part D, and then the Medicare supplement plans. So for those of you who might be new, we'll just quickly review enrollment in Medicare. I will be doing a session later today on new to Medicare. So if you are enrolling, there's more information to come later today. So there's the initial enrollment period, which happens 3 months before the month you turn 65 and 3 months after you turn 65. There are Part A and B penalties if you miss this initial enrollment period. The other confusion that is starting to happen is we all used to take Social Security at age 65, and we used to take Medicare at age 65. Both of those things are proving to be sort of, they don't always happen simultaneously anymore. So that causes a fair amount of confusion for people. We have then what we call the annual enrollment, and that is from October 15th through December 7th. And during the annual enrollment period, you look at basically your Medicare Part C if you are enrolled in a Medicare Advantage plan and want to change to a different one, or if you want to disenroll and go back to original Medicare and enroll in a Medicare supplement. And then the other thing is that you can enroll in a Part D prescription drug plan. If you miss the annual enrollment period, you can also enroll in Medicare from January 1 to the end of March. And that is called the open enrollment period, but that is only if you want to change a Medicare Advantage plan. If you miss that and you need to, your initial enrollment period, you can also enroll from January 1 to March 31. And then we have the prescription drug benefit plan, which is what we are in now. So quickly, there are 4 parts of Medicare. Part A is hospital insurance, B is medical insurance, C is the Medicare Advantage plans with the insurance companies, and D is the Part D coverage with private insurance as well. So just a quick overview. Original Medicare, as you can see at the top, is Part A, hospital insurance, and Part B, medical insurance. So sometimes you will hear people talk about original Medicare, and what they're talking about there is Part A and Part B. Part A then covers inpatient hospital stays, care in a nursing facility, hospice care, some home health. It does not, however, cover any doctor visits or prescription drugs. The doctor visits that you get in the hospital are covered under your Part B benefit. Then Part B is medical insurance, and this is basically the physician services, whether they're specialists or your primary care physician, outpatient care, such as emergency rooms, ambulances, labs, x-rays, medical supplies, such as wheelchairs, durable medical equipment, oxygen, and then preventive services. The two additional add-on services, if you will, is Part C, which is the Medicare Advantage, and that is sometimes described as an alternative to original Medicare, where it bundles, if you will, Medicare Part A and B, and it usually includes Part D, which is prescription drug benefits, although they don't necessarily have to do that. Medicare Advantage usually also adds some additional services, which include things like dental care, vision benefits, over-the-counter items, shopping catalogs. Some of the newer ones are also looking at food services like after a hospital stay. So there's some additional benefits. And then Part D is prescription drugs, again, sold by private health insurance companies. So Part A, just to make sure that everyone understands, covers 5 different things. Covers your inpatient care, both for acute care as well as chronic disease management in a hospital, as well as mental health care. If you have a 3-day hospital stay, it will also cover skilled inpatient rehab and skilled home care. And then for those of you who have known someone who has used hospice care, that is also a Part A benefit. So for 2024, the changes include that the deductible is going up from $1,600 to $1,632 for every 60-day benefit period. What that means is that if you go to the hospital, your out-of-pocket, either covered by you if you're in original Medicare or a Medicare supplement, is that you have to pay the first $1,632. If you have to go back to the hospital for any reason from day 1 to day 60, you do not have to pay that deductible again. But if you have to go back on day 61, then you are required to pay that deductible a second time. Again, that would be covered if you have a Medicare supplement and are in original Medicare. Part A is free. There's no monthly premium if you have paid 40 quarters of Social Security. If you've paid in less than that, if you have 30 to 39 quarters, you pay $278 a month. If you have less than 30 quarters, you pay $505. If you yourself have not worked 40 quarters, but have a spouse or have been married to someone who has worked 40 quarters, you can claim their Social Security, which then allows you to get Medicare Part A at no cost. In terms of the co-insurance, again, you pay that if you do not have a Medicare supplement. So the co-insurance for Part A for 2024 is days 1 through 60 are free. Days 61 through 90, which should you be unfortunate enough to have to stay in the hospital that many days, has gone from $400 up to $408. If you have to stay more than 90 days, then you are starting to use your lifetime reserve days, and that is $816 a day, up from $800 a day. If you have to stay in the hospital more than 150 days, if you do have a Medicare supplement, sometimes they will pay that. There are still limits, unfortunately, on psychiatric hospitalization, and that is limited to 190 days per lifetime. Again, if you use more than 190 days in your lifetime, then you have to use the lifetime reserve days of 8, and the cost is $816 a day. The second benefit for the skilled nursing is that after the 3-day hospitalization, there is no cost to you as the individual for days 1 through 20. Days 21 through 100 is $204 per day. If you have a Medicare supplement, again, that would pay that. If you have a Medicare Advantage plan, you would have to pay that out of pocket. If you haven't put your self on mute, could you do that? We're getting a lot of feedback at this point. So after day 100, if you are in a skilled nursing facility or you no longer need skilled services, then you have to pay 100% of the cost. The coinsurance for home care, if you have had a 3-day hospital stay, home care is covered at 100%. Again, if it's medically necessary, meaning that you need skilled services. And then hospice care is 100% covered, except room and board, either in a hospital or a nursing facility. There is a $5 copay for prescription drugs. There's so just to review, home care then provides these kinds of skilled services. They provide skilled nursing. They provide physical, speech, and occupational therapy, which is the service that we most frequently see. And they can provide some types of durable medical equipment, such that if your situation was that you needed, like say, a hospital bed or something like that, that also can come out of, can do this. Now, durable medical equipment is usually charged to your Part B benefit rather than to your Part A benefit, but it can be charged to A. You do have to use a home care agency that provides skilled care and is licensed with the state of Colorado, as well as has a Medicare license. On the skilled rehab in a long-term care facility, again, you have to meet the 3-day hospitalization. These services usually include intensive skilled care, which are things like speech, physical, and occupational therapy. And I use the word intensive because there usually are a certain number of minutes that you have to receive the skilled therapies if you are going to have them charged to Medicare Part A following this hospitalization. You can get some care under skilled rehab if you're in a long-term care facility under Part B, but it's not as intensive. The hospice benefits then, just again, you have to have a terminal diagnosis of 6 months or less. It's authorized for 60 days, and then it can be reapproved for another 60 and then 90. And if you are still continuing to experience a decline in your health, it can be extended. The important thing to note is that some people are discharged from hospice care. If your physical health is not declining, then we do see sometimes individuals discharged. For hospice services, you pay $0 for the actual hospice care. This includes a physician, it includes nurses, it includes social work services, clergy services, any kind of volunteer care. Sometimes there might be some therapies involved if they're trying to just kind of improve your ability and your quality of life. So all of those services are provided to you at no charge. As we said a few minutes ago, there's a $5 charge for prescriptions. If you have a loved one in respite care or in your own home, you may choose to use respite care. And if you do, this is like maybe for 5 days or a week, say in a skilled nursing facility, and there you would pay 5%. The important thing for a lot of people is that they get very confused about who pays the room and board if you are in a skilled facility or if you are in a hospital or a long-term care facility associated with a hospital or a standalone extended care facility. In those places, you always pay 100% of the room and board. The hospital inpatient acute or psychiatric care, couple things that you should just know about. One of them is this Medicare Outpatient Observation Notice, or sometimes called a MOON. If you are in the emergency room basically for more than 24 hours, even if they give it to you at 23 hours and 15 minutes or 59 minutes, they have to notify you whether or not they are planning to keep you in observation or whether they are planning to admit you to as an outpatient. So one of the important things to know is that sometimes people are in the emergency room for a midnight, and then they are there as an outpatient, and then they get moved as to an inpatient facility, and they're there 2 nights, and so they think that they have been in the hospital for 3 nights, but they've only been an inpatient 2 nights, so then they're not eligible, if you will, for the skilled rehab or the skilled home care. And so that is the primary reason for the hospital having to notify you. Additionally, there's another notification that everybody should get. If you are an inpatient, you should be getting something called an important message from Medicare. And one of the things included in that is your rights as a patient. But the second thing is that this is the document that begins to tell you when you are going to be discharged. And if you feel that you are not being discharged at the time that you're ready to go home, you can ask for what's called an expedited appeal. And the hospital has to file that, gives you then 72 hours, if you will, for that appeal to be reviewed. If you win the appeal, there's no cost to you. If you lose it, you do have to pay. However, the important thing to know is that most of the time in my recent experience, when I've had patients ask for an expedited appeal, usually the hospital will give you another day or 2 just because they don't want to go through that process. Other tips is that you can be always admitted directly as an inpatient. You don't have to go through the ER. Important thing, though, is to make sure, especially if you go through the ER, that you know that you are either as an inpatient or you're in observation status. And make sure, again, if you think you need any type of rehab, you will need to be in there as an inpatient for 3 midnights. Let's switch our thoughts then to Medicare Part B, which is medical insurance, outpatient, and preventive services. So the services in the green are covered by Part B. So these are physician visits, specialists, and primary care, nurse practitioners, some physician assistant visits, outpatient care. As I said a few minutes ago, this is ambulances, emergency rooms, labs, x-rays, outpatient hospital-based services, that kind of thing. Home health care then is also covered under Part B, as we saw under Part A. To get it, you have to be in the hospital for 3 days, 3 midnights. Under Part B, you can continue to get home health care without the 3-day hospital stay. The home health care at this level is usually things like diabetic monitoring. It could be wound care. So it's usually requiring some type of a skilled service, but available either in, say, an outpatient clinic at the hospital for wound care, or the wound care nurse may be coming to your home. Durable medical equipment. This is things like wheelchairs, oxygen, canes, bathroom adaptations like commodes, the raised toilet seats, that kind of thing. And then the preventive care, which includes things like welcome to Medicare physical. You get one of those in your lifetime. The annual wellness exams where you visit the physician, they review your advance directives. They will look at your prescriptions, kind of go through what it is and what things are happening. And then there are things like mammograms and colonoscopies and heart heart procedures, again, trying to just make sure that you're healthy. Also now includes vaccines. Things that are not covered are hospital visits by the physician, skilled nursing, any dental, vision, or hearing, hospice care, and prescription. Those are covered by Medicare, just not by Medicare Part B. And the dental, vision, and hearing is only available if you have a Medicare Advantage plan. So the premiums for Part B for 2024 are going to vary by income. Most of us will pay the $174.90, which is kind of the standard. If your annual adjusted gross income as an individual is less than $105,000 or $210,000 as a couple, then you'll be paying the $194.90. Other people who have additional
so it's not fixed.
Other people who have more income, adjusted gross income, will pay higher premiums and could go, if your adjusted gross is up to about $500,000, you'll pay $594. The annual deductible for Part B is $240 this year, up from $233. This is an amount, if you are in original Medicare, that you will always have to pay unless you have an old Medicare supplement plan F, then it would still be covered. But you would have had to buy that plan F Medicare supplement prior to January 1, 2020. So this is just a review of what we just said. Part B, out-of-pocket expenses, then Medicare pays 80%, and you as the individual pay 20% of the Medicare approved charge. It's important to know the difference between an approved charge and a physician, or a charge by your physician or your provider. Approved basically means that this is the amount that the Medicare says the procedure is worth. So if you go to the doctor, for example, he charges you $100. Medicare decides that it's worth $40. That $40 becomes the approved charge, and Medicare then pays 80% of the $40, and you are responsible for 20% of the $40. If your provider accepts Medicare assignment, meaning that they will accept whatever it is that Medicare charges, in the example, they'll accept the $40. They choose not to accept the $40 as an approved charge, then they can charge an excess charge up to 15%. So in our example, again, they could charge 15% of the approved charge of $40 or an additional $6. If you have a Medicare supplement, plan F, or an F or a G or a D, that will pay that. Other plans may or may not pay depending on what you have. There is no annual limit on the Part B charges. So as many times as you go to the doctor, there's always going to be that charge. So Part B and Part D vaccines no longer have a copay. So the Part B vaccines, these you need to get at a doctor's office, a community clinic, or a pharmacy. The reason that you want to make sure that you get them at one of those types of facilities is that they can bill Medicare. So you can get a flu vaccine, a pneumonia vaccine, or a hepatitis B. Some types of vaccines, such as shingles, Tdap, and COVID-19, you need to always, always, always get those at your pharmacy, because your doctor's office usually, or your community clinic, is not approved to bill Medicare Part B. They're only approved to bill Medicare Part D. So that is the reason for getting them at the pharmacy. So just make sure that whatever injections you get or vaccines, that you get them at the right location and you no longer have to pay a copay. A little bit about Medicare supplements or a Medigap insurance. So Medigap pays your doctor's bills. They pay the 20%. They pay the approved amount, and they pay the excess charge. The benefits of a Medicare supplement is that basically it is designed to fill coverage gaps, which is a little bit different than a Medicare Advantage. So a supplement pays basically what Medicare doesn't. A Medicare Advantage plan combines your A, B, and D benefits and provides them as part of one plan. So your Medicare supplements are standardized regardless of the carrier. So if you buy a Plan G, you can buy it from State Farm, Mutual of Omaha, United Healthcare, doesn't really matter. If you buy a G, it's a G, it's a G. You can go to any doctor as long as they accept original Medicare. You don't need any referrals to see specialists. They are guaranteed renewable, meaning that the company cannot cancel you. So if you used $1 million worth of care this year, as long as you pay your premium on time, they cannot cancel you. And your costs are predictable because you pay your monthly premium and the Part B deductible, and that is basically all you have to pay. You do have to have Part A and B to apply. And they are, as I said, sold by private insurance companies. You do pay this monthly premium, and the amount is dependent on the type of plan, how old you are, and what company. So I just updated our records, and there is a huge amount of variation depending on the company that you go with, sometimes as much as $60 or $70 per month, depending on the company. You do not have flexibility usually if you do a Medicare supplement. Once you buy a Medicare supplement, you pretty much need to stay with that the rest of your life, unless you are in good health and are able to change plans. But if you have any pre-existing conditions, usually you're not able to switch. The plans that Medicare supplements currently sell are an A, a B, a D, a G, a K, an L, M, and N. They all have different variations, and I will be doing a session on the difference between Medicare supplements and Medicare Advantage if you wish to join us during open enrollment. These are part of our Wednesday Lunch and Learns, so check your email for when that will be offered. The most important thing for a Medicare supplement is that you must buy a standalone Part D prescription drug plan. Let's switch our thoughts now to a Medicare C, Part C, Medicare Advantage. And as we've said a couple of times, this includes A, B, and D, inpatient hospital care, nursing homes and hospice, outpatient care, physicians, preventive care, and then outpatient drug coverage. There are 5 different types of Medicare Advantage plans that are sold in Colorado. There are HMOs, which are, the most common type. The HMO, basically you use all of the doctors and labs and x-rays of the HMO, and they pretty much decide all of your care. The preferred provider organizations are the PPOs. Sometimes this is a good option for people because it can give you the benefit of a lot of the HMO benefits, but then you can go outside the network for selected care should you opt to do that. The private fee-for-service is my least favorite in this. The private fee-for-service, basically, you have the same basic HMO coverage with original Medicare services, but your providers have the option to choose whether or not they are going to take your insurance at every single visit. Now, the companies do have to have a network, so you can stay in that network, but you also have the ability to go out of that network, and then the provider can choose whether or not they are going to take you at each and every visit. We have these new plans over the last 10 years or so, and they keep adding new ones. So D-SNPs are basically for people who have Medicare and Medicaid trying to provide additional services. C-SNPs are in the community, and those tend to be, D-SNPs. And then the community ones tend to be focused more on chronic disease, and the I-SNPs are for people who are in an institution such as, say, a nursing home. And then we also have the point of service programs, and these are really designed for people who are the snowbirds. So if you are looking for a Medicare Advantage plan and you say you want to go to Arizona for the winter, then buy their point of service program rather than their HMO, and that will give you the ability to get health care while you're out of the zip code. Out of pockets, most of the Medicare Advantage plans are offering at least a 0 premium product this year. They may have higher co-pays and co-insurance, but that's a really big selling point. If you do have a premium, it can be deducted from your Social Security check, or you can send them a check every month. The out-of-network and in-network caps, again, in reviewing the companies that are selling Medicare Advantage plans this year, The lowest cap appears to be about $2,900 a year, which would be your out-of-pocket expense, up to $11,500 if you go out of network. The deductibles are usually zero, but they can be as high as $1,000. And the drug deductible, again, for these Medicare Advantages can be zero, but it also can go as high as $545. In terms of co-pays and co-insurance on a Medicare Advantage, usually there's a flat fee if you go to the doctor, the emergency room, and ambulance. If you use things like durable medical equipment and a lot of other Part B services, such as you had an MRI as an outpatient, usually your out-of-pocket is 20%. So if you had an MRI and you had a Medicare Advantage and it was $10,000, you might have to pay $2,000, which would go toward that deductible or that out-of-pocket cap. In terms of the prescription drugs, usually there's a flat fee for the different tiers of drugs, and that can either be zero or some small amount like $2 or $3, but some of them are going as high as 50% of the cost of the drug. And if you are in a skilled rehab facility, days 1 through 20 are free. 21, you would pay the $208 per day out of pocket. This is just a list of the companies that are selling Medicare Advantage plans in Colorado. We do have a new player in town called Select Health. So you may see additional promotion or talk, or those agents wanting to share that product with you. Medicare Part D prescription drugs, then let's switch our attention to that. These also are covered by private insurance plans. If you do have a company that charges a premium, which most of them do, that can be deducted from your Social Security check as well. We are in the open enrollment period right now, and will be through December 7th. Coverage then starts January 1 of 2024. So the important thing to know about prescription drug coverage is that there are 4 phases. So the initial phase is the annual deductible phase. This is when you are paying the $545 deductible, and depending on the plan that you buy, the deductible may be less than that, and sometimes the deductible is waived. After you have used $545 worth of drugs, then you go into the initial coverage phase, and here basically you are primarily going to pay 25% of the cost of the drug. So you're looking at the initial coverage going up to about $5,000. So your out-of-pocket is somewhere around $1,800, which includes the $545 deductible plus the 25%. And then you move into what had been very early on in the days of Part D, the dreaded donut hole. Congress over time has closed this donut hole, so it is lower than it has been for a very long time. Or ever, I should say. So after you get through the initial coverage phase, you go to the donut hole or the coverage gap. And when you are there, again, you pay 25% of the cost of the drugs. And overall, basically, when you're in the annual deductible phase, the initial coverage phase, and the donut hole or coverage phase, your out-of-pocket should be somewhere around $3,300 this year. And the reason for that being is that the Inflation Reduction Act changed, if you will, catastrophic coverage. So no longer do you have to pay anything out of pocket after the cost of your drugs of what you pay and what the pharmacy or the drug company pays, the prescription drug plan. After that gets to $8,000, then basically your drugs should be free. So those of you who are unfortunate to use really expensive drugs, that should be very helpful. In 2023, and it's continuing on in 2024, diabetics are now, the maximum that you can be charged is $35 for a vial of insulin per prescription per month. So if you have 2 different types, you would have to pay $35 for each one, but say you needed 3 vials for every month, then you would pay the $35 for the first, and then vials 2 and 3 would be covered in full. Not all plans on the prescription drug plans are covering insulin. So if you need to have a plan that covers insulin, make sure that you check the right for the right coverage. Out-of-pocket expenses for standalone Part D benefits then are premiums. There is one company that has a 0 premium. The highest company of the ones that are offered in Colorado is $129 a month. Sometimes it's important to know that rather than paying a lower premium, you may want to look at paying a little higher premium if some of your drugs are less required for prior authorizations, or if they have less utilization management, meaning how many pills will the company pay for per month. And so that's a little bit, sometimes it's easier to pay a little bit more money and have fewer restrictions on the drugs. Deductibles are $545, as I said, but some of the companies are charging less than that. There are tiers on all of these drugs, and so there's tier 1, 2, and 3, 4, and 5 on most of them. Tier 1 and 2 seem to be relatively low cost or free, and in tier 3, you start to be seeing some type of copays or co-insurance. So most of the time on these drugs, you're at 3, 4, and 5, you're now paying a percentage. So you're paying 25% of the cost of the drug, 33% of the cost of the drug. I didn't see any of them that I sampled go higher than 50% of the drug. And this works until you get basically to the $8,000 limit. And then we went through the diabetic coverage. The most important thing to know, which a lot of people are not aware of, is that your diabetic supplies, such as your lancets, syringes, and alcohol wipes, all of that can be covered by Medicare Part B, but you have to buy those from a Part B provider. So again, Walgreens will bill Part B, Safeway will not. So again, if you are paying out of pocket for those diabetic supplies, check to see whether or not the company you're getting them from will in fact bill Part B if they don't change their supplier. These are the companies this year that are selling Medicare Part D plans. And at this point, we don't have any new guys coming to the marketplace. The important thing on the AARP Walgreens United Healthcare is you do not have to go to Walgreens. That's just the name of the plan that they have filed with Medicare. You can go to CVS or your local neighborhood pharmacy. So a little bit on highlights. WellCare has a 0 premium Medicare Part D plan this year. And Anthem has the most expensive one of $132, with the average being around $71 in Colorado. So you'll need to make decisions basically over the next few weeks for your Part D plan, and then the new coverage will start January 1. So if you're trying to figure out which pathway to go, your Medicare supplement, Again, this is more for people who are new, or if you're considering changing from a supplement to a Medicare Advantage. You have a Medicare supplement plus a Part D. If you go to a Medicare Advantage, HMO, a PPO, then basically you get those all covered in. The question, do you qualify for Part B, Medicare savings then? The next couple of slides are directed at individuals who have a little bit lower income. So if your income is less than $1,660 as a single person or $2,239 per month, then you might qualify for Medicare savings to pay for your Part B premium. And if you're low enough income, basically it would also pay for your co-pays and your co-insurance as well as your deductibles. And you can only have $9,900 in resources or $15,600 as a couple. So you do have to not have a lot of money in the bank to be eligible for this. If you qualify for the Medicare Savings Program, you will automatically qualify for the Medicare Part D, low income subsidy or extra help, but that has a little bit higher income and resource requirements. So as an individual, if your income is less than $21,870 or a couple $29,580, you can qualify for help with your Part D premium as well as your co-pays. Again, your resources have to be under $16,600 and married couples $33,240. Some of you may have been in what was called the partial low-income subsidy. That has gone away this year, and everybody is in full Medicare low-income subsidy. So that is why these income limits have increased. So that's a little bit about just sort of the specifics. Let's just look for a couple of minutes at a little bit that's kind of happening in the future. So 2024, as we said, we no longer have to pay the 5% co-insurance for catastrophic. That all went away. And we just said that we increased the subsidy for people who are eligible for extra help. And what we see is that there should be a lot more people eligible, if you will, for help with prescription drugs. This is just a telephone number. Medicare has now initiated a live chat line. So you can get on medicare.gov and you can talk to somebody 24/7. Just again, as summary, the B and D deductibles in some instances have been reduced if you're in a Part C plan. The D SNPs tend to be looking more toward what they call give backs. So there's allowances for rent. One of the companies actually is giving you an allowance. I think it's $200 a month that you can use this money for rent, utilities, gas, food, whatever it is that you want to. But you do have to sign up for that MA plan, that Medicare Advantage plan, and you have to be receiving Medicare and Medicaid. Medicare is negotiating, as some of you may have seen, with the pharmaceutical companies for these 10 drugs, or 8 drugs, I guess it is. And these are the ones that under the current Inflation Reduction Act, one of the plans is to basically reduce to negotiate with Medicare directly with the pharmaceutical company so that the cost of those drugs will be lower. Dental care seems to be increased this year with Medicare Advantage plans, but we've also noticed that not all dentists at this point in time are taking all of the Medicare Advantage plans. So if that's important to you, then make sure that you figure out which dentists, your dentist or a dentist that is important to you, is also part of their network. Free COVID vaccines and boosters will continue, and vaccines, as we said, are free. Part D, drug pricing is really after you get through tier 1 and 2 and you get into drugs that are on tier 3, 4, and 5 on their formulary. You're looking at a percentage, and those tend to be going upwards rather than downwards. So make sure that you know that. MA plans also seem to be going upwards or increasing with their co-pays and co-insurance. Important to know that both Medicare Advantage plans as well as prescription drugs have made changes, as they always do, to which drugs are on their formularies as well as their tiers. So it's really important to go to the plan finder at medicare.gov, put your drugs in there, and make sure that you are aware of what the co-pays are going to be, and the co-insurance for the drugs that you currently have. Telehealth is good through this year, but it is looking at this moment like telehealth in 2025 is probably not going to be as common and frequently used. So that brings us to the end of this presentation at the moment. Just a little bit of information about the services and supports that you can get through the Gerontological Society over the next couple of weeks. We could help you with individual counseling and enrollment for Part A, B, C, and D. We are not licensed agents, so we can't enroll you in anything. We can help you enroll in D because that's an online enrollment. We can help you with A and B, but we can't sell you anything. You can also get counseling in English or Spanish. And we can also help you run your prescription drugs through the plan finder if you need support in that, and we can do that in English and Spanish. We can make referrals to insurance agents for Medicare supplements, Medicare Advantage, and prescription drug plans. The thing I forgot to point out, which can get really, really confusing, is that many of these companies, such as United Healthcare, Mutual of Omaha, Cigna, Humana, they all sell Medicare supplements, they sell Medicare Advantages, and they sell prescription drug plans. So just know that all of those companies can sell you multiple products. We are partnering with the University of Colorado School of Pharmacy again. So you can get some support with some of your medication reviews. These sessions will be posted on our YouTube channel. So if you have any interest in that, you can also visit our website for additional information. Our phone number for those of you who want it is 303-333-3482. Our toll-free number, if you're outside of Denver, is 1-855-293-6911. And our Spanish line is 1-855-880-4777. And just quickly, a little bit about some of our programs. We do offer grants for vision, hearing, and dental services, as well as mental health services in the city and county of Denver. Our dental services are available west of I-25 as well as Metro Denver. Vision and hearing are available in Metro Denver only. We can do advanced care planning throughout the state. If you would like a telephone buddy, someone to call you, or if you would like to call somebody, you're welcome to call. We do holiday baskets in December for Metro Denver only, and we have a housing and home care locator on our website, which can help you find other housing or home care for the both skilled care as well as community-based care. We also do a variety of education advocacy programs with our Salute to Seniors, multi-generational housing supports and services, our guidebook, our newsletter, etc. In closing, basically, the University of Colorado School of Pharmacy, we do have students who are available to help with some types of counseling and support. And they're going to be focusing on helping with vaccinations. In addition to that, sort of medication management. So if you would like to know more about that, please feel free to give us a call and we can set you up with a student. So thank you for that.